I just turned on the recording. I apologize. I meant to do that earlier. What I was saying is that if you're currently using an external system where you're recording your service logs, your progress notes, that type of documentation, the external provider interface will give you the ability to work with your system and modify your system in a way that you can export that data from your system and have it import into APD iConnect. So if you don't currently have a system like that, you don't need one. You will be able, when we go live with our providers in APD iConnect, you will be able to just log into iConnect, enter your service log data, and just do it right there in the consumer's record. So this is not something that you have to do. This is something that was developed because we are aware that there are several providers who do work with an external provider system, an electronic health record system. So we just wanted to be sure that that clarification is made. Our external provider interface will also in the future be something that you can use to export your 835 files for claim submission from your system into APD iConnect to be able to process your claims for reimbursement. I want to stress, because we get lots of questions and requests for access to iConnect to be able to submit billing. APD iConnect has not launched claims. Claims are not live in our system, and we're not going to be launching claims in this system in 2020. You will continue to submit your claims the way you always have. When we are ready to launch claims through APD iConnect, all providers will know. So if you're feeling like, oh my God, I don't have access, I can't submit my billing, you continue to submit your billing through the FMIS portal the way you always have. And you will know in plenty of time before we turn claims on in APD iConnect. So I stress that because, again, even yesterday I received a request for access because someone wanted to be able to submit a claim. So again, that's not happening yet. You can relax. You don't have to learn anything new about how to submit your claim. Our primary focus again today is to talk about if you have an electronic health recording system, how you can work with modifying your system so that it can export data that can be imported into APD iConnect when we roll APD iConnect out to you as a provider. We met last month and provided some information and some documents that will help folks if this is something that they wish to pursue. And today what we're going to do is go over some of the questions that many of you submitted since our last meeting so that we can help provide additional clarification and guidance. So with that, Zoe, I'm going to turn it over to you. I am monitoring the question panel, so if you guys have a question as we go along, go ahead and type that question in, and then Zoe, if it pertains to what you're talking about right at the moment, I may interject or we may just go over them at the end.
Thank you so much, Sheila. Can you change my permission so I can share my screen?
I can.
Thank you. Wonderful. Thank you. All right, Sheila, can you see my screen?
Yes, I can.
Okay, great. So I'll be going through the questions and answers, and we'll just kind of go on one by one. And like Sheila said, if you have a question, submit it to the box there. So the first question is, will the provider have to create the XML file? So the service provider is responsible for creating the user portion of the interface. That is the XML file from their current systems. XML is a widely used and accepted format for data transfer across disparate system and database platforms. Another question, will I be able to use other EHR systems, electronic health record systems, with APD iConnect? APD iConnect will have the ability to interface with external or third-party vendor EHR systems. Providers may have to modify their existing system to ensure it can export data in a format that APD iConnect can receive. When sending over XML files, can it be more than one note? The answer, the XML file can contain as many records as your electronic health record is set to send. Will providers be able to upload service log notes in a PDF or Word doc format or only XML? The external provider interface can only receive XML files in the format specified in the webinar. And I'll show you at the end of this session where you can find the August 21st webinar on video, and this one will also be posted on the website as well. Are providers expected to come up with an interface on their own if they find that direct entry into APD iConnect is not practical for them? So we, APD, will give you all the technical specifications for how to take advantage of this option, but it does require a technical capability to meet them. There is a cost-benefit decision about this, so IT resources may want to meet internally and discuss. It's a very structured solution to set up a file that will populate in APD iConnect. For some organizations, because of volume and work, it would be better to take advantage of the other option. So it's really up to you to discuss internally. When will a sample XML file be available along with the screen design and associated field mappings? So if you'd like to have a copy, you can email iconnect@apdcares.org. It's also presented as part of that August 21st webinar about the interface that we did before. Question if WSCs are going to be using the interface. So WSDs will not be using this external provider interface process. Because WSC progress is direct entry and attached to the activities screen, they're not able to use the interface at this point. Next question, based on the provider required documentation document, attendance logs can function via an interface. Is it possible to also have an attendance function for transportation trip logs via an interface? And the answer is yes, there are trip logs. Will providers be able to submit 837 files into APD iConnect? The answer is yes. Is there a product that you would recommend providers could use to generate the XML files? And that answer, we recommend just working with a developer or your IT team on that issue. Next question, can an Sftp upload be voided and resent? A secure file transfer portal upload be voided and resent? No, once it's sent, it's in APD iConnect. So APD users with a supervisory role can delete an activity report. If you use an EHR vendor, what needs to be modified? That is a question that should be asked to the vendor because they are the software solution provider. So just talk with the vendor on that question.
Hey, Zoe, can I pause you for a second there? Because we have a question in the chat that I think is related.
Okay.
When we met last week, last month, we went over some documents that included some of the technical specifications. Did we send those out?
Yes, those were sent out. I'm also going to be including those when I send the Q&A to the attendees of this meeting. So I'll just resend all of that again.
Okay, so there's a couple of you that have asked about the technical specifications. So just look for the follow-up email from today's meeting and you'll have them again.
Yes.
Thank you, Zoe. Sorry to interrupt.
Sure. Are there any other points you want to bring up at this point?
No, I just as a point of clarification, again, if you work with a vendor of your EHR system, once you get these documents, if you didn't already receive them, that's what you're going to want to take to them because they are the ones that have to develop your software solution for this. So that's where you start.
Thank you, Sheila. All right. The next question, is there a list of vendors that have already interfaced with APD iConnect? So since this portion hasn't gone live yet, there's not a list. Will monthly reports be an option or is everything going to quarterly? There are no anticipated changes to documentation requirements currently reflected in the handbook. Next question, if a provider is using a billing agent, will the billing agent info be included in this file? And the XML file doesn't have billing agent information. The 837 may include the billing agent.
And so let me go ahead and jump in there. We're getting a couple of questions about what is an 837. So again, I know some of you may not have attended the last meeting, and if you hear terminology today that you don't recognize, it probably means that you're not currently using that. An 837 file is a way that some providers and billing agents submit their claims for reimbursement through FIMS. So if you don't currently do that, you don't have to do that when we bring you into APD iConnect. What the external provider interface will do, though, is if you do use an 837 file, it will allow you to continue to do that, possibly with some modifications, and then import it into APD iConnect. So if you do have a billing agent, your billing agent knows what this means, and you'll probably also want to share those documents with the technical specifications with your billing agent. Thanks, Zoe.
Thank you, Sheila. Next question, I'm a provider using a different EVV system. That's a separate issue, but you will need to use the APD iConnect EVV system. Next question, when will I as a provider have my username and when will it be effective? So we'll be phasing in services starting with respite providers this fall, and before going live, the provider will be emailed the login information. If I'm currently doing the billing using an external program and I'm not the owner, will I be able to do any of this without the owner naming me as billing agent? Yes, the owner will have to grant the provider access to APD iConnect via ID path, and the provider will need to ensure that the owner gives them the ability to upload and download HIPAA data. Are XML service logs an optional replacement for 837 files? No, 837 is to transfer the claims data, and XML is to transfer the activity logs data. So that service log, trip log, attendance log, daily progress notes data, quarterly summary, and annual summary. Is there a way, or are there plans for a way to upload or download XML files programmatically? And if so, is there any information available now? Yes. XML and 837 files can be downloaded and uploaded from or to an APD hosted secure FTP site. This option is scheduled to be available beginning January 15th, 2021. So you'll receive instructions on that SFTP setup in early January 2021. For 837, is the goal to be able to programmatically upload the files in January? Yes. You'll receive information about this in early January 2021. For 835 remit files, it seems that the plan will be to be able to download from both sites once yours goes live with the data. Is this long-term or just a short-term crossover adjustment? So the answer is all providers will be able to download their 835 from the FIMS portal as they do in the current process, even after claims are submitted through the APD iConnect system. So there will not be any changes in the near future. Where can I learn more about what the system looks like? You can watch the overview videos online here, and I'll show you this in a minute, and check out the provider library here. The question, is this what we will have to do to bill each day? This is just an option. The interface is to enter provider documentation. In the future, the 837 is how you can submit your billing. You'll be using APD iConnect instead of FIMS to submit claims. Claims will not be going live right now, so continue to submit claims as you have been. And we addressed this question as well, will Wses be using the external provider interface? The answer is no to that. Those are the questions that I have. So at this point, I'm gonna open the overview video page and show you what that looks like. So if you go to our APD website and go to waivers APD iConnect, you can navigate through these links on the left side and you'll see there's lots of presentations and video presentations, documents. You can see overviews here. Under the provider library is where you can find this video presentation of the webinar from last August. I would also suggest checking out the frequently asked questions, which shows you can organize it by user. So you go to providers and you can review the FAQs for providers here. At that point, Sheila, I think I've gone through all the questions. So I will ask you, I'll turn it back over to you.
Thanks, Zoe. We did have one other question come in that I answered in the chat, but I wanted to go ahead and bring it out for the group because I imagine it's probably a question that's on everyone's mind, and you actually had it there. That question about the EVV, can you scroll back to that? I'm going to leave you as the presenter in case we need.
Sure.
Yeah, this question here. This question prompted a follow-up question, and that is, will EVV be able to utilize the external provider interface? And the answer is no. Once APD goes live, APD iConnect goes live for EVV delivery of respite, personal supports, and nursing in a non-licensed setting, and those 3 services will go live for EVV at different times, and those providers will be notified well in advance. But using respite as the example, because that is the first service that will go live for EVV delivery, electronic visit verification delivery, once that happens, then you will have to use our APD iConnect EVV system. So if you currently have another system that you're using for EVV, there is not the ability to modify and export your data from that system and continue to use it and have it import into APD iConnect. You will have to switch over to using the APD iConnect EVV system. So I just wanted to make that point of clarification because I know that EVV is already considered electronic data. It just isn't something that is going to be supported in our external provider interface. We also have a question about whether or not the Q&A document will be shared, and you're going to send that out after the meeting, Zoe, with the documents from last meeting as well, correct?
That is correct.
I do see that we've got some folks that have your hands raised. If you could type your question into the question box, then we'll go ahead and go from there. Has the EVV system been updated to allow the direct care staff to submit in draft so adjustments can be made from an administrative standpoint? For example, correct spelling errors, those kinds of things. I would have to check on that, Danny. I know that you've asked for that before, and I know that we're looking at that. Some of it is I'm positive is already editable, but I have to go back and look at, did we get that change in for the actual service log data? But if we didn't, it will be. That was one of the things that we had definitely shared with WellSky after one of our meetings, after our presentation on that. So that if it's not there, it's coming. And then we have a question, is there a device you have to use for EVV for consumers who do not have phone or internet and also blocks caregiver internet? So I don't want to take a deep dive into how EVV is being set up because today's call really is about the external provider interface. What I can tell you is that we have information on our website about electronic visit verification. We also, if you are a provider of respite services, you should have already gone through training in your region. If you are a provider of personal support services, you should have already gone through training or have registered for a training over the next few weeks. And if you're a provider of nursing in a non-licensed setting, stay tuned. There's a training coming to a town near you very soon. And so in that training, there's more information about EVV. The other thing that I want to share with you is that we do have an on-demand webinar that will be published and posted on our website. Today is Friday, next week, and that webinar will be a self-paced training for how to access our EVV site and deliver a service. And at the end of that, you will have the information that you need to be able to go and actually deliver an EVV service in our training site. So more information for EVV is out there already on our website in the training material you may have already received. So I really don't want to take a deep dive into those EVV questions. What we can do is just, you can keep typing them in, and after the meeting, we can go through them and update our FAQs on our website. So let me see what else we have here. I do see a question about the specific date where we're going to go live with the respite services in APD iConnect. And as Zoe mentioned a few minutes ago, we will start phasing that service in groups. And I don't know that we have a specific date just yet, but as soon as that information is ironed out, an advisory will be going out to everybody. And you'll know when it's time for you to go live. You'll know when it's time for you to complete your registration for ID Pass, and that's what starts the process for you to be able to get your access. I promise you, you will know when it's your turn. For those of you who are saying you haven't been contacted or haven't received anything for training for personal supports, if you could just type in, oh wait, let me finish reading that question. If you receive training for respite, the training for personal supports is exactly the same thing. You do not have to go through training again. We broke it down in identifying the respite providers first. And again, if you're a personal supports provider, then you got all of your training at once. And then for the second group, because we knew that personal supports would go live second, then we were identifying all of the providers of personal supports who had not already received training. If you are a personal supports provider and you haven't already participated in training, then what you can do is using the question box here, just type in your name and your agency's name, and I will share that information with the trainer for your region. Oh, also please add your region so I can share it with the right trainer. What data are group homes going to be required to upload? So again, there's no requirement to upload data. Utilizing the external provider interface is totally an option that is available to providers. If you are using an external vendor for electronic health records that you're currently recording group home related data, then you may want to consult with your vendor to see if this is something that you want to use when it's your turn to go live in APD iConnect. But there is no requirement to upload. You will have the ability to log in and directly enter that information. That being said, I recommend that you go to the video that Zoe showed you just a few minutes ago in our iConnect webpage, and watch the video from our last meeting, because we did a little bit of a demonstration there, talked a little bit about the types of documentation that are included in the external provider interface. So things like a quarterly summary, an annual report, those are included, but that information goes into much more detail about that. Let's see, what else? Hang on, I'm scrolling. So this is a question from a support coordinator, and I'm going to read the question so that everybody can hear it. As a support coordinator, we do data gathering for support plans while at the home of the consumer. We enter such data in on APD iConnect, which becomes a copy and paste exercise for a long time, more than 100 fields on the support plan. And I understand what you're saying about the support plan and how much data goes into that. Is there a way for us to develop our own collection system and have an XML file to upload the support plan into iConnect? And Carlos, that's an excellent question. And what the difference is that the way the external provider interface is currently designed, it focuses on the provider documentation. And as a support coordinator, I know that you've been in iConnect and you know what I mean when I say the provider documentation tab of a consumer's record. As you know, the person-centered support plan is on the forms tab in the consumer's record. So the external provider interface is not currently equipped to handle the importing of form data. Is it something that we might be able to look at in the future? That's a possibility, but at this point, the external provider interface handles only provider documentation related data.
Sheila, I just want to add to what you said. Can you hear me?
Yeah, go ahead, Sriram. Thank you.
Okay. So, yeah, in future also when we are able to accept, more data from the providers or waiver support coordinators, that will still have to be in the acceptable format defined by APD. It's not going to be a provider A will send some data in format A, and the provider B will send data in format B. So whatever the external interface, the file formats that we will be accepting is as long as that is meeting our expected format. So I just want to clarify that. Thank you.
Sure, that's a good clarification. Thank you for that, because what that says to me is that if you are one of those folks that are thinking that you want to start working on a way to develop your own system and your own ability to export into a file, I'm going to say hold off, because again, the external provider interface currently doesn't support that type of data anyway. And if and when we do add that in the future, you're going to want to wait until that is set up so that we can then give you the technical specifications so that you know how to modify your system. So and Carlos specifically, looking at trying to create an XML file, we don't know that it will be an XML file is the point I think Sriram is trying to make. So it's good to be thinking. I think it's always good to be forward thinking, but don't put a lot of effort in yet until we are at a point where the external provider interface may be able to support other types of information to be imported in. For behavior analysis, providers will there be a date set as well? And yes, that is an excellent question. I know that all providers are really wanting to know, when is it my turn? And when am I going to get training? When am I going to go live? I want to make sure that my agency is ready. And I know it's a little frustrating to kind of be in the dark right now, but I assure you that as we set the schedule for the different services, the procedure codes, the providers of those services will be notified. Our history has been that we try to start training at least 90 days before that procedure code or that group of providers is supposed to go live in APD iConnect. We could do it now, but if you're not scheduled until, let's just say, February of 2021, you might not retain it all. So we try to get the training in about 90 days or less in advance of any particular provider's go live date. So trust that we will get that information out to you. Trust that we will make sure that you get the training that you need. And then the most important thing is make sure your information is current with your region. Make sure your region knows who the agency owner is and how to contact them, because when it's time to schedule training for behavior analysis, for example, we need to be sure the regions know who to contact. So that's the best thing you can do right now, is just make sure your region knows who you are, where you are, and how to get in touch with you. And we have another question on, can we pull data tracked in EVV from iConnect interface in an XML file? So let me make sure I process that. You're asking, can you pull the EVV data out of APD iConnect and put it into your system? And Sriram, I don't believe we have that capability, correct? Our external provider interface does not support that, correct?
Yes, that is correct. Yeah, I'm still trying to understand the question because are they asking Can they extract the data out of EVV system? Yeah.
I'll read you the question, the way it's written, and then I'll tell you how I interpreted it. And
Okay.
Can we pull data tracked in EVV from iConnect interface in an XML file? So I interpreted that as, can they export EVV data from iConnect in an XML file? That was my interpretation.
No, yeah, what you said is correct, Sheila. Yeah.
Okay. And if I misinterpreted your question, just type it in again with clarification, and I will see it as I scroll down. Yes, just to confirm, for those providers that work in multiple regions, if you've taken training already as a respite provider or currently as a personal supports provider in one region, you do not have to take it again in all of the regions that your agency serves. Just, it's a one and done kind of training. Okay, we touched on that. That is a repeat question. Will we be able to use the interface for documentation beyond service logs, progress notes, IIP, quarterly and annual reports? That is a really good question. And first and foremost, I just have to say that the implementation plan in the APD iConnect system is considered a form and not a documentation type. So that is actually not something that is presently supported by the external provider interface. Right now, the external provider interface supports only provider documentation, and that includes things like service logs, trip logs, attendance logs, quarterly summaries, annual reports. There might be one more in the list, but I don't have it right in front of me. And that's all that the external provider interface supports at this time. And again, for those of you who are saying that you already participated in respite provider training and you haven't been contacted for personal supports, it's because you only have to go one time. So you've been excluded or excused from the current round of training because you've already participated in training and you already have your certificates. And for everybody that's asking for the information that we're sharing today, we have all of your email addresses that you used when you registered and signed into the call today. And that's what we'll use to send the information back out. So we have your information. Does iConnect provide the ability to generate or export XML files as input to an external system? So Shriram, this one is very, very technical, at least to me. With the external provider interface, is there data that can be exported out? And I'm just going to use service log data as the example that can be exported from iConnect and a provider can use to import into their existing system.
So we have some options, to extract the data out of iConnect system as a provider, but we cannot guarantee that that format will perfectly work when they are using that or when they are planning to use that and input to some other system. So yes, yeah, we have limited options. You can extract the data in the form of a report or an Excel from the iConnect system, certain sets of data, but that's the extent that we can assure you. But once you extract the data, so how the providers will be using, what modifications they will have to do to use that data source, to input into another system or some other action. So it's up to them. There might be some manipulations that they need to do, that some processing they might have to do. So we cannot guarantee that. So yeah.
Thank you, Shriram. I appreciate that. And that was the last of the questions that I see. Again, I see several of you have posted in information about wanting information about training. And again, we'll follow up with the trainers in your region. But I don't see any other questions. So Lisa, I'm actually going to turn it back over to you. And I think we might be finished today.
All right, perfect. Thank you, Sheila. Thank you, Shriram and Zoe. And if you do have questions, please email them to the APD iConnect email address. And I really appreciate your attendance. Again, if you have questions, please email us to the APD iConnect email address. And Zoe, you said you would be mailing out the information to all the providers that have signed on for this webinar. So you should be getting that as well. Thank you very much, everyone, and have a great weekend. Bye.
Thanks, everybody. Bye.